Are you pregnant and wondering if you should continue exercising or you should start an exercise routine? My name's Dr. Brooke Kalisiak, and I'm the owner of Legacy Physical Therapy. I'm a pelvic physical therapist who is passionate about helping pregnant women optimize their body for their pregnancy, labor and delivery, and beyond. The simple answer to a question of should you exercise during pregnancy is yes, but it really does depend on your fitness level already, what you like to do, what your comfort level is, and your overall how your pregnancy is progressing. So by all means, if your medical provider has said that you need to go on pelvic rest or bed rest, you need to be listening to that advice. But if you are cleared to be exercising during pregnancy, what the vast majority of women are, there are so many benefits to exercising during your pregnancy. It can help to minimize your chance for developing low back pain. It can help to improve your chance of not needing a C-section. It can help you maintain a healthy weight and reduce the risk of gestational diabetes. It can help you sleep better during your pregnancy, which is a big one that bothers a lot of women during pregnancy. Exercising during your pregnancy can help to improve leg swelling, which is another common issue that a lot of women deal with during their pregnancy. It can help you to avoid constipation or other GI issues, and it can help you feel overall more energetic and just more comfortable throughout your pregnancy. So exercising has benefits to both the mom and the baby during pregnancy. And it doesn't have to be mass quantities of exercise. You can get these benefits from as little as 20 minutes a day doing different types of activities. So next I want to talk to you a little bit about how you can think about exercising safely during your pregnancy. Now that you've decided to exercise during your pregnancy, here are some suggestions to keep it safe. First, think about exercising in a cool, well-ventilated place to avoid overheating. Second, pay attention to what you are feeling in your body. If you start an exercise and you start to experience pain that doesn't go away quickly afterwards, you're experiencing bladder leakage, pelvic heaviness or pressure, a sense of urgency, all of those things are signs that your core system might not be dealing with these new pressures and new stresses, and this needs to be evaluated. Third, think about what type of exercise you're doing. Pregnancy is not a time to start training for a marathon if you've never been a runner. It's also not a time to start Olympic powerlifting if you've never lifted before. But it is a time where you can start being more active if you haven't been active in the past. But start slow. Maybe think about going for walks if you've never been active. Prenatal yoga program is a great way to work on balance and flexibility. Strength training is just fine during pregnancy, but you might want some help and guidance to make sure that you're doing it correctly versus just starting up on a program on your own. So think about what activities your body may be used to or not used to, and start slow into those activities, because this is not a time where you're going to necessarily set a personal record for pushing your body the hardest or the fastest. As an adjunct to number 3, if you are already dealing with joint aches and pains, it may be beneficial to think about doing swimming as a form of exercise or water walking. This can be especially comfortable in that third trimester where everything seems like it's aching. Getting in the water to waist high will take away 50% of your body weight, and it can feel so comfortable to be supported by the water and moving around, like I said, either swimming or water walking. So if you are already dealing with aches and pains, if you have the ability to get in the water, that can make things feel so much more comfortable. And my fourth piece of advice for exercising safely during pregnancy is to think about partnering with a pelvic PT so that we can evaluate what's going on with your muscles in and around the abdominal and pelvic area to see how you're already recruiting things and see where there might be some imbalances or some issues in how your muscles are performing so that we can direct you to specific exercises to correct any of these imbalances, as well as guide you on what exercise programs might be a good fit for you, especially if you're brand new to starting exercise. At the beginning of this video, I talked about some of the many benefits of exercising during pregnancy: improving your sleep, lessening your risk for C-section, improving your labor and delivery, minimizing the chance for low back pain, helping your overall energy level, helping you keep and maintain a healthy weight gain during pregnancy, and potentially avoid gestational diabetes. But one of the best benefits of exercising during pregnancy is that you're giving your body a head start for recovering postpartum. So if you start to get your muscles stronger and working better together and your cardiovascular fitness level improved during pregnancy, this can pay over in spades in that postpartum period by having all your tissues be at a better starting point so that that postpartum recovery can feel a little bit easier and happen a little bit faster for you. So that should be a big motivator to think about being active during your pregnancy so that that recovery afterwards is that much easier. Hopefully, now that we've talked about all the benefits of exercising during pregnancy, you might feel ready to continue on with a current exercise program or to start up a new one. But you might be having many questions about how to perform those exercises best, making sure you're optimizing things for yourself and how your muscles are performing, or just in general, what's safe to do during your pregnancy. If that's the case, you're not alone. And I'm here to tell you now might be the time to partner with a pelvic physical therapist so that we can, again, assess what is going on with your muscles individually to make sure that we tailor that exercise program specifically to meet your needs so that you can stay active and comfortable during your pregnancy. You can get your body ready for labor and delivery, and you can optimize your body for recovery afterwards. So if you're thinking of starting up this journey on an exercise program during your pregnancy, I highly recommend partnering up with a pelvic physical therapist to help you out. Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.